Hi guys, today I'm gonna talk about the eye socket in your face. It houses the eyeball. What do you think? How many bones contribute to forming this eye socket or orbital cavity? One bone? No, it's more than one bone. 7 pieces of bone, they come together and they make the eye socket or orbital cavity. So today I'm going to focus on the orbital cavity, the bones that contribute to the bony orbit. So as you see here, orbit, if you look at closely, orbit, it looks like a pyramid. It has a pyramidal shape. The base of the pyramid faces anteriorly. This is the base that is known as the orbital margin. And the apex faces posteriorly. So my pointer going back and shows the apex. So this pyramid has a roof. This is the roof. And it also has the floor. Here is the floor. And medial wall and the lateral wall. So I'm going to show you one by one which bones contribute to the roof, floor, medial, and lateral wall. So if you look at here, this is the roof of the orbit. The roof of the orbit, mainly, it is formed by this bone, or the frontal bone. Here is known as the orbital plate of frontal bone. And a little bit posterior to the orbital plate of frontal bone, we have the lesser wing of a sphenoid. So lesser wing of sphenoid bone and frontal plate of the frontal bone, orbital plate of frontal bone, they come together, make the roof of the orbit. So the roof of the orbit separating the orbital cavity from the anterior cranial cavity. So you can see from the superior view inside the cranium. This is the anterior cranial cavity, middle and posterior cranial cavity. So anterior cranial fossa, we have orbital plate of the frontal bone, and a little bit posterior here you can see the lesser wings of the sphenoid bone. So these two, they make the roof of the orbit. It's separating anterior cranial fossa from the orbit. Opposite to the roof, we have the floor. So look at here. In the middle of your face, you can see the maxilla. This is the maxilla, upper jaw or maxilla. So maxilla mainly makes the floor. So this is the orbital surface of the maxilla that makes the floor. A little bit lateral to this, you can see this bone. It is called the zygomatic bone or zygoma. So medially we have maxilla, laterally zygomatic bone. A little bit posterior we have another bone. This is small bone. It's called the orbital process of palatine bone. So 3 bones come together make the floor. Students get confused with the palatine bone and they ask me repeatedly how the palatine bone contribute to forming the floor of the orbit. Actually, you can see the palatine bone here. It's an L-shaped bone, has the horizontal plate and vertical plate. The horizontal plate contributes to forming the hard palate. And the vertical plate sends up to the floor of the orbit. This is the orbit. It is called orbital process. So the orbital process is more posterior on the floor. So on the floor we have maxilla and zygoma anteriorly. Posteriorly we have a little bit the orbital process of the palatine bone. 3 bones contribute to the floor. And just keep in mind the floor separating the orbital plate from the maxillary sinus. You know, within the body of the maxilla we have maxillary sinus. So it's really thin. The maxilla, the orbital surface of maxilla is really thin. So if you just punch the orbit in the blue out, it can break the floor. So it's really dangerous. What about the medial wall? If you look at the medial wall, we have some bones, 4 bones. This one is the maxilla. The frontal process of maxilla protrudes upwards to the frontal. It's called frontal process of maxilla. A little bit posterior, this quadrangular bone is known as the lacrimal bone. Just behind the lacrimal bone, this is the lacrimal bone. If you look at closely, you can see the lacrimal bone. Behind the lacrimal bone, we have a quadrangular shaped bone here. It is called the ethmoid bone. This is the ethmoid. This is the orbital surface of the ethmoid. And then finally at the back, we have the body of the sphenoid. So 4 bones: maxilla, lacrimal, ethmoid, and finally at the back we have the body of the sphenoid. 4 bones, they come together and contribute to the medial wall of the orbit. So the ethmoid, the orbital surface of ethmoid is really, really thin, and it's separating the orbital cavity from the ethmoidal sinuses. So 2 walls are really thin. One of them is the floor, the other one is the medial wall. Opposite to the medial wall, we have the lateral wall. This is the lateral wall. Anteriorly, we have the zygomatic bone. So zygoma contribute to the forming the floor and lateral wall. And posteriorly, we have another bone. It's called the sphenoid, greater wing of a sphenoid. So you can see the greater wing of a sphenoid from the outside and from the inside. Only 2 bones, zygomatic and greater wing of a sphenoid, they make the lateral wall. So you can also see the orbital margin that makes the base of the orbit. This is called the orbital margin. Here is the superior orbital margin, and down here we have the inferior orbital margin. Superior orbital margin forms by the frontal bone and a little bit zygoma. Inferior orbital margin formed by the maxilla and a little bit zygomatic bone. We have some groove here on the medial wall. I forgot to show you. It's called the lacrimal groove. Just maxilla and the lacrimal bone, they come together. There is a depression here is called the lacrimal groove. So lacrimal groove, into the lacrimal groove we have lacrimal sac. So lacrimal sac, the tears coming from the supralateral part of the orbit from the lacrimal gland and wiping or washing the cornea and drains into the lacrimal sac that sits into the lacrimal groove. So we have some openings and fissures that are connecting the orbit to the neighborhood structure. So here we have the lateral wall I showed you, lateral wall separating the orbit from this fossa. It is called the temporal fossa. Here is the lateral wall. It's formed by the zygomatic bone and the greater wing of the sphenoid. It's separating the orbital cavity from the temporal cavity. Here is the temporal cavity, so temporalis muscle sits here. What about the openings that I mentioned? I'm going to use these wires to show you the opening. If I put my wire into the apex that passes through this canal and it gets into the orbit, and it gets into the cranium. So it's called the orbital canal. So this is the optic canal. This is the optic canal. My wire into the optic canal, you can find it from the anterior view. So the optic canal makes the apex of the orbit. It allows the optic nerve, cranial nerve 2, plus ophthalmic artery passing through. Optic nerve, ophthalmic artery passing through this optic canal. And it's part of the lesser wing of a sphenoid. This is the lesser wing of a sphenoid I showed you. An optic canal is part of the lesser wing of a sphenoid. A little bit lateral to the optic canal I showed you. This is the optic canal. A little bit lateral to this, we have a slit. It's called superior orbital fissure. This is the superior orbital fissure. You can find it here. This is my wire, superior orbital fissure. Superior orbital fissure is formed by the lesser wing of a sphenoid and greater wing of a sphenoid. So it's between the lesser wing of a sphenoid and greater wing of a sphenoid. It's an important fissure because it allows the cranial nerve 3, 4, 6, and first division of the 5. 3, 4, 5, 6, 4 cranial nerves passing through the superior orbital fissure, getting into the orbit. and supplying the eyeball and extraocular muscles as well. We have another orbital fissure here. This is the inferior orbital fissure. It's connecting the orbital cavity to this fossa, infratemporal fossa. Here is known as the infratemporal fossa, and this is the inferior orbital fissure that is connecting the orbit to the infratemporal fossa. This is temporal fossa. Below this we have infratemporal fossa. In between them you can see the zygomatic arch. So you can see the inferior orbital fissure is between the maxilla that makes the floor and the greater wing of a sphenoid that contribute to the lateral wall. Inferior orbital fissure is important because the maxillary nerve passing through, and then maxillary nerve gives a branch. It's called infraorbital. So infraorbital nerve passing through the infraorbital groove. It's on the orbital surface of the maxilla, and then it passes through the canal and emerges here from the foramen, infraorbital foramen. You can see my wire passing through. So infraorbital foramen is here, and up here we have supraorbital foramen or notch. Supraorbital, infraorbital foramen. So this is the orbital cavity. As a quick wrap up, it's a kind of pyramidal shape, has the base faces anteriorly, apex posteriorly, and four walls, has a roof, floor, medial wall, and lateral wall. Some opening like optic canal, superior and inferior orbital fissure, connecting the neighbors to the orbital cavity. And we also have the lacrimal groove I showed you. It's just on the medial side of the orbit, medial corner of the orbit. Hopefully that would be helpful. And next video, I'm gonna talk about the eyeball and extraocular muscle. Thank you so much for your attention.